There are draconian cuts in the bill for Massachusetts, 400 to 500 million, depending on how you count, before you get into the provider tax assessment and all of the other kind of things that happen later in the bill. So it's just a straight up cut of payment. Medicaid's a state federal program. There's a share, and the people who are probably the least costly to insure are most impacted by this program, the so-called able-bodied adults, who are matched at 90% at the federal level. So it costs 10 cents on the dollar for the state of Massachusetts to provide health insurance to an able-bodied individual. That person, maybe spends, maybe on average, between $2,000 to $5,000 a year in care, and that's an average, including somebody who had a catastrophic illness in there, and we believed it's going to cost significantly more than that for us to make sure that they are meeting the work requirements. Our view in Medicaid is that in Massachusetts, and we have data to prove this, is that 60% of the people on Mass Health are working. That's the name of the Medicaid program. And the 40% who aren't can't. They're either taking care of somebody disabled, they're disabled themselves, or they have young children. And so the idea that there's some, large swath of people who are suddenly going to be available to the workforce, who are staying out of the workforce because of their Medicaid benefits, I think is just flawed public policy. And we know from experiments that Georgia and from programs in Georgia and Arkansas that the cost of getting able-bodied people far exceeded the cost of their health insurance. So we have work to do as a state to be ready for that requirement because it's on us. And then we have to really watch what happens with the exchanges, because of the people who are on the exchanges in Massachusetts, a big chunk of them are so-called premium supported, and that's where the cuts to Medicaid will really hurt our ability to cover everybody. Massachusetts uses federal dollars as part of a broad compact that started in 2008 with coverage for all, and we're kind of definitely that's in peril.